This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hi, everyone, and welcome to Health Yeah, your prescription for common sense medical health and wellness information. I'm Monica Robbins. Today, we are talking about the opioid epidemic and how the pandemic is impacting those battling substance use disorders. A new CDC report just released finds that the number of overdose deaths has now reached 100,000. That is the largest single year toll ever recorded. The study looked at deaths from April of 2020, that was the beginning of the pandemic, if you'll recall, until April of 2021. Ohio, of course, is no stranger to the opioid epidemic, and in past years has been one of the leading states for drug overdose deaths in the nation. Experts say the current overdose deaths are largely from fentanyl and meth and cocaine. Ohio saw a near 27% increase in overdose deaths over that time that the CDC was looking at from 19 to 20. The state recently started a Beat the Stigma education and marketing campaign. And Ohio, earlier this year, received $24 million from the recent opioid settlement from one drug company, but may be receiving more from other lawsuits still pending. But what will it take to get control of a problem that seems to once again be spiraling out of control? To help sort through it, I gathered experts in the field. Jason Joyce is the executive director of the Hitchcock Center for Women. He's also a licensed clinical counselor and an independent chemical dependency counselor. Tom Stuber is the president and chief legislative officer of the Lakota Way and adjunct professor of addiction counseling at LCCC. And Tom recently retired as CEO of the Lakota Way after leading that organization for 21 years. Pam Boyer is the clinical director of the Women's Recovery Center, and John Lissy is the executive director of the Shaker Heights Youth Center. Thank you all so much for joining me in this very important conversation. Did you notice any changes in the treatment population before and after the pandemic began?
Before the pandemic, our agency usually our population comes from people that are mandated by either the courts or Children and Family Services. But now we're seeing a lot of self-referrals more than ever. I've been at the agency for 20 years and I've never seen, at our agency anyway, a lot of self-referrals. And also after the pandemic, I've noticed a difference there's more diversity in the socioeconomic status. So we're seeing a lot of women with less barriers, they're more educated, having higher incomes. We're also seeing like a change in the age groups. Pre-pandemic, our age groups were like in the 20s, 30s, and 40s. And now we're seeing people come to treatment in their 50s, 60s, and we even had a 75-year-old. And also we're seeing a change in the drugs of abuse. We always had, marijuana, alcohol, pre-pandemic opiate abuse. We're seeing more opiate abuse, but we're also now seeing methamphetamine use.
Monica, I think that one of the things that we're seeing is simply the consequence of the isolation that's occurred as a result of the pandemic. We're seeing a lot of individuals come in with significant amount of anxiety and depression that has occurred because they've been isolated for this period of time and living under a significant amount of fear or threat of possibly catching the COVID. And so I think that has changed the profile somewhat of those seeking treatment now. But we are seeing a surge of people seeking our care that we haven't seen for quite a while. And I think part of that is because people have been hunkering down to try to get through the COVID.
Pam, have you asked any of the folks who are coming in, are any of them first-time users, or is this something that, like, especially with the older population, that maybe they had dealt with substance use disorder when they were younger, and then because of the pandemic, fell off the proverbial wagon, if you will?
Yes, we do have a lot of first-time clients who well, I'm not going to say they're first time because they've used in the past, but their drinking or their usage did become more problematic during the pandemic when they were isolated and stuck in the house. And a lot of them, especially the older, were dealing with a lot of medical issues and were prescribed pain medications, and they couldn't afford it. And then they went to the illicit drug use.
John, you see typically a younger clientele. So, can you talk about how the pandemic impacted youth seen by your prevention providers?
Sure. Yeah, prevention serves a large segment of youth, ranging from a kind of a universal population to those who are struggling but not in need of treatment services. And really, almost all the youth that we've been in contact with have been impacted by COVID. And we're just beginning to see that impact of trauma. The youth have lost in-person education for long periods of time, and that's disrupted their learning and isolated them. There's been examples of violence in Bedford schools and Akron schools that have made the news, and I think a lot of that is pandemic related. The school disruption, the pandemic fears, and really the extreme polarization of our country, I think all contribute to that. So we're seeing a lot of kids who are showing their trauma, and then there's a lot of kids who don't show that they've been impacted and quietly go about their business. But all of them really need support to build resiliency and to cope with the many stressors they've had. So we kind of come from a wellness philosophy, identifying strengths and viewing youth as a work in progress and not as an individual with a problem. So our goal really is to build resiliency by building relationships with caring adults and providing support and teaching life skills and how to deal with stress and those sorts of things.
Jason, let me move on to you. The state of Ohio just started the Beat the Stigma campaign. And one of the issues, even though we have a lot of new people because of the isolation, because of the other issues, who may be now dealing with a lot of these problems, talk to me about what is the biggest misconception of addiction or mental health disorders?
That's a great question. And I think just even a little background on the stigma piece. So according to the Surgeon General, around 21 million people age 12 and older have some sort of substance use disorder. Out of that 21 million, only around 10% get treatment. So the vast majority do not get treatment because of that stigma. So I think fighting that stigma is huge. And it just even equate it to pure numbers, right? So 21 million, obviously a lot of people, sounds like a lot of people, right? But to equate that to another diagnosis of very similar to the same rates as diabetes, right? So certainly diabetes seems very common. People know each other who have it. You hear about it quite a bit. So that's sort of the prevalence rates of substance use, right? So when we're talking about stigma, that is the core reason why people don't do it. And a lot of it is misconceptions, right? So that, when we think of what is addiction, what is addiction? Kind of a general question, right? So, it's a repetitive drug-seeking behavior. And a lot of people think that it starts off as it's their choice. They're using, that's their choice to use. And maybe the first time that they use, but by the time they're in the throes of addiction, it's no longer a choice. And that's really what we talk about when we say addiction is a disease, that, at some point it no longer becomes a choice. And I think really kind of having people understand that, getting out there and advocating for that, helping others to kind of get a good understanding of what substance use is will help the community at large treat this large scale issue.
Yeah, one of the biggest issues, and I was very happy to hear, Pam, that you said you have a lot of self-referrals, because one thing that stigma tends to do is prevents people from seeking the help that they need.
Yes, I think it is a good sign that people, I know the women, they're coming, they want help. these women are coming, they're talking about, how traumatized they were, and they just want help. And they want to have better relationships with their families and their children. And, so yeah, we are, very, very happy to see a surge in, self-referrals.
COVID shutdown had a significant impact on access to care. So what procedural changes did Licata have to make to deal with that?
Well, in early 2020, which was the onset of the pandemic, our first concerns were how do we keep our customers and our staff safe? So in residential treatment, we had 12 residents, and that was already a reduced capacity due to the pandemic. But we also had between 160 and 180 active customers in treatment receiving care at that time. So we implemented a number of protocols. We suspended outside visitors. We suspended home-based services, and this is when we first implemented telehealth and telephone services. We suspended internship placements through the colleges, although that was reinstated once we went to telehealth. We implemented reception and front desk check-ins, including temperature checks and CDC questionnaire, mandated masks, social distancing, and implemented a sanitation schedule where every one of our facilities was sanitized 3 to 4 times a day. And we used our transportation staff to be able to do that. And we had to adjust our human resource policies to accommodate those staff who came down with symptoms of addiction. And then March 16th that year, we sent out press releases, customer and referral source emails, social media announcements, and changed our website to inform the community that we were still providing services, that telehealth was available for some of our services, and that we had implemented all kinds of COVID protection procedures to ensure that we could keep them safe. We then had to implement a work plan where we took and reviewed every one of our staff, and those that could work from home were going to be working from home, which meant we had to establish home work offices, which were equipped with the technology necessary for them to deliver care. And at that point, we ended up purchasing 35 computers to be able to set up our clinical staff with the ability to provide telehealth. Well, at this point, we're still utilizing all of the telehealth services as available. We have started some on-site group counseling again and intensive outpatient treatment for those that have been vaccinated and are able to come and participate. But we still utilize full masks, social distancing, and have limited the amount of services that are provided on site.
Give me the pros and cons of telehealth with the Women's Recovery Center. How has it been utilized, and what impact have you seen?
Some didn't have computers, some didn't have, smartphones, to receive the services. And then if they did have, smartphones or computers, they didn't have sufficient enough data plans. And then we went in, we kind of ran into other issues, some technical difficulties with, losing the connection. We tried to create the environment of having group therapy, online. So that was a challenge. And then there was the challenge of, HIPAA and confidentiality. So we constantly had to, tell the clients that they need to go find a private space. As a clinician, it was difficult for us to express warmth or empathy. It's difficult to do those things virtually. So sometimes your virtual-based conversations, may lead to miscommunications, and, clients were upset, turning off their cameras and things of that nature. So those were some of the major difficulties in the beginning that our agency had to deal with. But we implemented some rules and enforced some rules, eventually that the clients got used to.
John, how about you? How did you implement telehealth, and what were the pros and cons from your perspective?
From a prevention perspective, especially working with the little ones, trying to engage a a kindergartner or first grader on the telephone and keep their attention for longer than 5 minutes was a very, very difficult task. With the little ones, usually if we're meeting with them at school, we're playing a game with them or doing something like that to engage them so that they feel comfortable and are able to talk. That was a real challenge. The other challenge is that we actually ended up doing a lot of in person because the children were out of school, and there were just some children who absolutely could not function at home academically. They were never on their tablets and not doing the work. So we actually implemented learning pods for each of the segments of the Shaker schools, so that some of those children were able to do some academic pieces. The other thing that we did was kind of pivot towards serving the community. So because so many people were in stress just around things like housing and food, we really got involved with other community partners to make sure that their food was being delivered to folks, and we were getting donations and getting those donations to people who needed it. So it changed kind of what we were doing, but we felt fortunate that we were still able to serve the community.
Now that we're past it, Tom and John and Pam, I'm curious to know, is telehealth still going to be, a regular part of your treatment process these days?
Absolutely. What we've done is Licata's been providing telehealth services since 2009, but this tool had limited utilization based on many of the restrictions that had been imposed under rule. Primarily the requirement that the customer have face-to-face meetings prior to implementing telehealth services. The obstacles that made telehealth necessary, meaning people couldn't access care, were keeping it from being effective. The COVID-19 pandemic and the loosening of restrictions have led to full utilization and significant learning about the true benefits of telehealth. Engagement and access to care are critical beginnings to successful outcomes. So the Licata Way has been offering and will continue to offer telehealth services, both in terms of medical, including medication-assisted treatment, counseling, including group, individual, and family therapy, psychoeducation, and also assessment. And because there had not been a lot of research done on the effectiveness of telehealth, we decided we were going to track our own, and both in terms of engagement and reliability, as well as customer satisfaction. JAMA just last week came out with a study that did indicate that telehealth is very effective for certain populations. Children were not one of those populations, and seniors who are not technologically comfortable with one of the populations that it didn't. But that 18 to 64 age group seemed to do very well with telemedicine.
That telehealth also helped you expand your reach.
Right now, we have clients in Ashtabula County. I think that's the furthest, but we had some clients who moved and wanted to continue services. So Stark County, it's been wonderful in that regard, being able to, have them still continue their treatment at the place where they, wanted to get treatment. I think telehealth services are here to stay. We're operating in a hybrid format right now. So some of the ladies are on site and some of them are, virtual. And it helps, with the barriers of getting to treatment. There's still some women at home who are still taking care of children who don't have childcare. And so it still allows them to come to treatment.
All right, let me throw another topic out at you all. Cuyahoga County was actually starting to see a downward trend in overdose deaths a few years ago after a record year in 2017 with 727 deaths. Now it's looking like we may surpass that record number this year. Why do you think that is, and what do you think needs to be done about it? Jason, I'll start with you.
When you talk about treatment, there's no one size fits all, but there are some certain themes that we know that are helpful. Right? And the number one on that list is access. So if you start to remove access to treatment, you're going to likely see an increase. And obviously the pandemic reduced access to treatment across the board, not only for substance use related treatment, but all treatment. So I would say that is the number one contributing factor in terms of why you've seen such an increase. And then also the other factors of people are at home more, maybe they lost their job, maybe they were bored. That's going to be more likely to use substances, because the main reason that the people use substances is usually to try to fix something else that's going on in their life. Whether that's they're stressed or anxious or bored, or they want to please somebody else, whatever it is, that substance is usually, at least when it starts, is trying to fill that role. And then, as I talked about before, it leads to addiction, which then is harder to stop. Looking forward to the future, where we need it right now is two main areas. So one, with our workforce, much like other workforce, they have been ravaged in terms of either with, afraid to work with COVID, chose another profession, haven't graduated maybe as many from the schools. We're certainly seeing a reduction across the board in workforce, in people willing to work in the field. And the second one is infrastructure. As you see more complexity, whether it's with telehealth or how we deliver our services, you need more funds for infrastructure to be able to build and reach the people that you're looking out to.
John, what do you think?
I think another aspect of the increase in death is really the difficulty connecting with ongoing community support groups like AA or NA. For a while, almost all meetings were virtual, and I think for many people that was interesting at the beginning, but those personal relationships, I think, would help keep people sober, and that includes things like being in church or other kinds of supports. And without ongoing community support, I think it's very difficult for people who are addicted to chemicals to stay sober.
From my perspective, well, we just recently started a trauma group. And so from the ladies who have been attending our trauma groups, they were, they're sharing that, being at home isolated and things like that, they were like into their thoughts and, having flashbacks and, just thinking about all the things that have happened to them. And so it kind of, made them want to self-medicate more. But I would like to see, more, women's treatment specifically.
We're seeing the overdose deaths increase and the overdoses overall increase significantly. And I think the reason is that we are actually in the fourth phase of the opiate epidemic. We started with narcotics or pharmaceutical opiates. We then went to heroin. Then went to fentanyl, and now we're finding fentanyl mixed with psychostimulants. And with each phase, we found that the individual being treated has been more difficult to treat, that the addictions become stronger and more controlling. And going back to what Jason said, Jason helped the Ohio Alliance of Recovery Providers complete a survey of agencies. And what we found is that all of the agencies in OARP have significant work shortages, ranging from 4 to one organization that had 100 clinical staff that were positions that were vacant. And that we found that there were, on average, 4 months to fill a position. Well, if you've got somebody a position that's open, a clinical position, that's 12 individuals that are not going to receive treatment that day. The addiction field, with the primary reimbursement being Medicaid, we have not seen a significant increase in rates since 2004. And if you were trying to run your household with the same money you were making in 2004, you would have a difficult position too.
If you were the one who had the checkbook, Jason, I'll start with you. Where does the money have to go?
I think it goes to coordination of services. I think, obviously, with workforce, but I think even more specifically with coordination of services. So we've seen some of this money at use in Cuyahoga County with the diversion center. And I know they're kind of going through the process and making sure that it gets set up the way that they want it to get set up. And, there's been some hurdles there, but I'm confident that they'll get through them. But I think that's where the money is going to be most impactful. When you're looking at something that can not only touch one population or one person, something that can help coordinate across the whole system. The ideal would be something that would help coordinate more effectively through people's levels of care so that they could have tight coordination with all the services they receive, whether it's primary care or specialty care, but right down to substance use, that it's really valued and looked at everywhere across that continuum.
Education is such an important part of that. About 60% of the addiction workforce doesn't have a degree in or an advanced degree in addiction. So even getting the workforce more educated and then bringing people in. And I think we do a great job actually at the associates level of teaching addiction services. So putting some money into educating the workforce, doing some stipends for them, because most of the people who are CDCAs, chemical dependency counselor assistants, don't make too much money, but really incentivizing their education and getting them to get at least a degree, and then looking at what we can do to increase education on the bachelor's and master's level, as well as the PhD level, would be huge.
Tom, I know you have like a top 10 list, I'm sure. So where would you start? Same with education and getting more people in the workforce, or if there was something immediate, what would you do with it?
The first thing that I think that is absolutely essential as we are setting up the One Ohio Foundation is that we put the money, or we use the money in a way that is sustainable. To do one-time projects that will start a program but not have continuous funding to keep that program going means that we're going to hit a wall down the road. And then on top of that, we need to find a way to entice people to come back into this field. And that when they look at the economics, it's not a very enticeful thing. Many people will enter this field because they want to help, which is wonderful. But then nobody wants to go and end up not being able to adequately support my family.
John, talk about the legislative efforts that have been put forth to deal with this crisis.
There's been funding that's come down to in prevention, with the social emotional services for youth. Also funding come down for treatment. The loosening of the telehealth rules have really saved many, many lives, I believe. And then, looking at overdose prevention strategies, and I think that's coming down on a federal level, but looking at not only the naloxone and fentanyl strips, needle exchange, those sorts of things. People, obviously we're in the business of treatment, but people have to come to treatment if they're alive, and if they're dead, they are no longer going to be coming in our doors. So we have to look at ways of keeping people alive and then nudging them to treatment. And I think some of the initiatives have helped with that. We've looked at the increase in addiction workforce, and we've studied it, and OMAS, the Ohio Department of Mental Health and Addiction Services, have done some studies, but we really haven't implemented. So I think we have to build on the studies and implement. I think also the increase in recovery support has been something that's been funded and has been organized. So I think probably all of the agencies that do treatment have now peer support, and I think that's an important piece that's been implemented.
Thank you all so much for being part of this incredibly important conversation, and hopefully we will see a turn in what we're seeing right now. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Subscribe and find video podcasts on my YouTube channel, Monica Robbins. Until next time, have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.